Hello everyone, I hope and I believe you all are doing great. This is Dr. Arya, your pathology faculty. Now, today we will be studying about large intestine, the pathology of your large intestine. So, what are the normal structures? Just like this, you have MSMS, mucosa, submucosa, muscularis and serosa. In the mucosa, you are having crypts and there is no villi. In the submucosa, you are having blood vessels and lymphatics. In the muscularis propria, you are having inner circular and outer longitudinal. Then you have the serosa layer. Now, listen to me very carefully. The first condition that you have is your Hirschsprung disease. So what happens in Hirschsprung disease? There is congenital aganglionic megacolon, as a result of which there is absence of ganglion cells. There is absence of ganglion cells. Now what will happen? There will be a failure of relaxation. As a result of which the patient will present to you with delayed meconium, distension and constipation. There will be abdominal distension. Next you have is the inflammatory bowel disease. In inflammatory bowel disease, mainly we have red 2, that is the ulcerative colitis. Next one is your Crohn's disease. So coming to the ulcerative colitis, the site is, it starts in the rectum and continues to spread proximally, not distally, it spreads proximally. Then you have inflammation. There is inflammation of mucosa and submucosa only. In the gross, I am able to see the pseudopolyps and there is loss of Hirschsprung. Now what are Hirschsprung? See, if we draw like this, normally this kind of structures are there, but if the patient is having ulcerative colitis, see over here the folds are present, it is normal. Now here is loss of Hirschsprung. So this is what it is. What are the complications? The complications will be, my patient will be having toxic megacolon and carcinoma. For the treatment, I will give my patient steroids and surgery. Coming to the Crohn's disease. Now, Crohn's disease can be there in any part. Mostly it is there in your terminal ileum and colon. Inflammation will be transmural and skip lesions. As I have already told you in the small intestine part, that there will be skip lesions will be there in your Crohn's disease. In the gross, I am able to see cobblestone mucosa and fissures. In the microscopic, I am able to see that the granulomas are there. What are the complications? The complications can be, there can be strictures, fistula, and the patient may present with the malabsorption syndrome. Coming to the infectious colitis. So now we know that infection can be classified under as bacterial, viral or parasitic. I have three options. Either it can be bacterial, either it can be viral, either it can be parasitic. So in the bacterial one, I have Shigella, then Salmonella and Campylobacter. These are the three causative agents for your bacterial. Then you have in the viral, you have is the cytomegalovirus, that is mainly seen in your immunocompromised patients. In the parasitic one, you have the amoebic colitis. And in the flask-shaped ulcer and trophozoites are there. The flask-shaped ulcers will be like, this is my skin, this is the normal skin. Now ulcers will be somewhere over here. It will be a flask-shaped ulcer. It will be a flask-shaped ulcer. Then you have the ischemic colitis. Now in ischemic colitis, the cause is atherosclerosis and hypotension. Affected splenic flexure is there, and the pathology is, you are able to see there is mucosal necrosis and hemorrhage. In the clinical, I am able to see there will be pain and bloody stools. Diverticular disease, there is outpouching of mucosa through the muscle layer. It is due to the low fiber diet and increased pressure. The complications are diverticulitis, perforation and bleeding. Next coming to is the polyp. So in the polyp, you need to remember that it is mucosal protrusion into the lumen. You have the two types. It can be either non-neoplastic or it can be either neoplastic. So what is non-neoplastic? You are having hyperplastic and they are inflammatory. In the neoplastic one, it is adenomatous. Next coming to the colorectal carcinoma. So in the colorectal carcinoma, you need to remember that it is most common GI malignancy. It is the most common GI malignancy. Risk factors are your adenomas, inflammatory bowel disease, diet and genetic. In the gross, you are able to see annular, napkin ring, lesion on the left side and polypoids on the right side. Next, if I talk about the pathology of the appendix, although we will be studying appendix separately also, let's just see that. So, you are having acute appendicitis, that is, there is lumen obstruction. Then you have the neoplasm like carcinoid syndromes, that is the most common. In the summary table, you need to remember just the ulcerative colitis and the Crohn's disease. In the ulcerative colitis, remember it is continuous, mucosal, crypts and abscesses will be there. In the Crohn's disease, you are having skip lesions, transmurals and granulomas. Then in the diverticulosis, you are having mucosal outpouching. And in the ischemic, you are having necrosis and hemorrhage. This was all about this chapter. If you have any sort of doubt, please feel free to ask me. Please feel free to DM me. Thank you.